Hi, my name is Zagy Berian. I'm the UN Secretary General's Youth Advisor on the climate change, and I'll be moderating today's discussion, a very special discussion about One Health Summit 2026.
Pleasure to welcome you at the French Embassy. As you know, we are very supportive of the UN action and very happy to work with you today.
Zagy, very great to be working with you.
Please.
Today, we're gonna talking about something that's connect all of us, our health, our environment, and then our futures. One Health Summit 2026 that will be held in France. So I'm very happy. Today, I will be surrounding amazing people. Your Excellency, Mr. Fabien Penone, as Ambassador of the France to Indonesia, Timor-Leste, and ASEAN. Welcome, sir.
Bonjour. Welcome to the French Embassy.
Thank you so much. And then Ibu Gita Sabharwal as the UN Resident Coordinator. Today also, we are talking about partnerships. And then we talk about how can Indonesia, France, and UN and its agency can strengthen collaborations to strengthen the global health approach for the One Health system. And before we discuss, I wanna ask a very short questions. When you hear about One Health, what comes to your mind, and why should young people care about it today, Your Excellency?
I think it's quite simple. One Health is about the connection between the human, animal, and nature health. We have to adopt a comprehensive approach regarding these issues. Let me just give you one very concrete example. If you look at the Nipah virus, basically it has been transmitted to humans through bats, which were before eating and contaminating fruits. This is an example of these links between nature, animals, and humans.
Wonderful statement. Thank you so much. Ibu Gita?
Super, Zagy. I'm going to build off what the ambassador said. And my sense is One Health is very simple to understand.
Yeah.
It's about healthy people, healthy animal life, and a healthy environment.
Yeah.
And as the ambassador pointed out, these three are interrelated, interconnected, and interdependent, which means if one gets affected, all of them are affected.
Sure.
And I believe that young people have an important role to play in this.
Yeah.
They can raise awareness. They can use their digital skills and communication tools like you do
Thank you.
to prevent the spread of diseases that Ambassador pointed out, and investing in a healthy environment, which is extremely critical for the resilience of future generations.
Sure. Thank you so much, Ambassador and Ibu Gita. So let me discuss further with Ibu Gita. Ibu Gita, we can see like for the One Health system, Indonesia and UN and its agency like WHO, FAO, and also UNEP, how the collaboration work in the practice, and how can Indonesia can also has been playing very actively to support the global approach of the One Health system.
So, Zagy, no one agency or country can address One Health. We need partnerships.
Sure.
That is extremely critical, and that is why we are here today, right, with the French ambassador.
Sure.
So, the UN, through players like WHO, FAO, and UNEP, are working very closely with government. In this case, the Ministry of Health, Ministry of Agriculture, Ministry of Environment and Forestry, and the Ministry of Forestry, together with their network of public health officers and veterinarians, to basically do four things. One, they monitor early signs of zoonotic outbreaks and investigate them. Two, they look at hotspots, monitor and report on hotspots. Thirdly, you prevent the spread of these zoonotic diseases through robust surveillance. And finally, build community responses because you want communities responding the minute they see signs of this using digital apps for early identification and response. And I want to end by saying that UN works closely with international partners, including CIRAD, which is the French-based agricultural research center, along with BRIN, to invest in this kind of scientific research for robust preparedness.
Sure. Thank you so much. So, as young people, we need some really simple examples how the One Health system can improve the everyday life, like a safer foods and also safer environments and, preventions for the better disease in the future.
Right. So, Pasagi, I've got a simple example. We all buy chicken and eggs in the market, right? And we all want to make sure that the chicken and egg that we buy is safe, clean, and free of diseases. So from a One Health perspective, this implies that your veterinarians, the vets, are monitoring chicken health to ensure that you do not have any diseases such as bird flu. Right? Your agricultural officers should be looking at farms to make sure that the waste is being managed properly so that it doesn't contaminate water and soil. Right? Similarly, your health officers need to be looking at issues of food safety and local markets, which will make the chickens and the eggs that we buy safe to eat.
Safe to eat. Thank you so much, Bu. So, Indonesian youth especially knows you really care about the young people in Indonesia. So, what you suggestion that Indonesians youth can, support the One Health within the communities and then innovations and also advocacy.
So Pazagi, thank you for that question. Very critical. Young people have a very important role to play, and that's why we are meeting together today along with the French ambassador. This is exactly the reason. From where I sit, I think there are three things that young people can do. Firstly, they can invest in helping us with early detection using digital applications. Right? They need to invest in innovation. The low-cost developing low-cost apps, other innovative low-cost technologies to be able to monitor and help us with One Health-related issues. And finally, through advocacy, we want young people raising awareness. Sharing facts. Because that's very critical for preventing diseases. Right? And investing in healthy environments. So those are the three things that young people need to do more of.
Sure. Really amazing. Thank you so much, Ibu Gita, for the answers. And Your Excellency, Ambassador. So we know that One Health system will be held in Lyon in a couple of months from now. And from what I know also, France take the priority for the One Health. So the question is why the priority is for the One Health, the Ambassador?
France is supporting science and research for long. And it has always been a priority for the French government, for our country. We have major scientists like Louis Pasteur, who was one of the pioneers for vaccinations. And we have famous institutes like Institut Pasteur. So we always think that we need to bring science when we develop policies, public policy. And this is the case for health, generally speaking, but especially for One Health issues. This is why we want these new policies to be driven by science, and we will, in Lyon, not only have heads of state and government, but also scientists gathering. So there will be a conference involving academics, experts, scientists, the days before the conference at the level of state and government. And they will bring their results of their discussions to our heads of state and government. This has been a priority for multilateralism generally for France, whatever the issue. We need to put science at the center of our policies.
Yeah, thank you so much. So all of the delegation high level will be gathered in Lyon in a couple of months from now. And, like from the summits, we need to transform the global discussion into very meaningful impact in the futures, like the concrete solutions and also the strengthened partnership. So what is your thought about that?
Yes, what is the objective of the summit, the One Health summits? Basically is first to put for the first time ever at the level of heads of state and government One Health issues. Because we need clear appropriation at the highest level. We need to fix clear orientation for the work for the future on these questions. But we need to work not only with the government, we need also to bring on board, I mentioned it before, scientists, but we need also to involve the local community, the business, the civil society. So we will bring together all the stakeholders in Lyon, as France has been doing for other issues, like for instance, we did before with the Indians on artificial intelligence. The only way to be able to tackle such a complex issue is to bring all the necessary stakeholders. And the awareness raising of the population is also very important. This is why we will bring especially the youngest with us.
Yeah, thank you so much. So the last question, in terms of the global partnerships, how can countries like Indonesia can strengthen the global health and also environmental challenges in the future?
I think first for France, Indonesia is a key partner. We are working with Indonesia on a bilateral basis, but also on the international stage. A country from the north, a country from the south, we share the same value, especially we support multilateralism. And in this dire period, when we have so many challenges to tackle, especially on global issues and health issues, it is important to work together. And I have to say that Indonesia on health issue is at the forefront. So for us, this is the natural partner to work with for these issues on One Health. And there are many scientists, many experts in Indonesia too.
Yeah, thank you so much. And the last question for both of you, because we know like young people watch us discuss about the One Health. So what your suggestions for young people can take small actions but can have some meaningful impact in the futures? Ibu Gita first.
Thank you, Pak Zagy. Each of us, not just young people, I believe we all have to consciously look at reducing waste. And this means seeing how we can eliminate single-use plastics in our everyday life. Composting our organic waste at home, if possible, right? It also means recycling the paper, the bottles, the cans that all of us use in our everyday life, right? And I really believe that finally we also need to dispose of electronic waste responsibly because of the toxins that it can release into the soil and the water. Right. So I think these are the four things, and investing in this is going to ensure a healthy environment and we all remaining healthy.
Yeah. Thank you so much, Ibu Gita. Your Excellency, Ambassador.
I think the first thing is education. The more people are educated, the better they understand the numerous problems we have to tackle. So education, education, education. That's what we are doing for France, that's what we are doing for Indonesia. So for the One Health Summit, that will be also a priority. I was mentioning the scientific dimension, but also the training, the education will be important as objectives. Second, concrete actions. Sometimes we think these are just about big policies for the government. No, on a daily basis, on a daily life, we are all responsible for the future of our planet. So be it waste management, be it consumption, we need to be aware of the consequences for our planet. And this is what One Health is about. Taking into account the whole dimension of health, be it nature, be it humans, be it animals, they are all interconnected. And our daily gesture, daily actions may have an impact on this global health.
Yeah. Thank you so much, Ambassador. Thank you so much for both of you. So today, this is a very fruitful discussion, especially for us, young generations. And One Health is a very, man focusing on the global issue. So we need to working closely, working together across countries, across sectors, and across generations. And we hope the One Health Summit 2026 will be very successful in the France. And for young people, we are not the futures, but we are already taking part for the today solution. Thank you so much and see you later. Bye bye.
Thank you.
Thank you.